I'm Mrs. Prinsey, Associate Professor in Mental Health Nursing. Today I'm going to talk about few of the disorders which can be seen in the childhood period or during the adolescent period. So apart from the other childhood psychiatric disorders which you've already learned, there are some few disorders which are very few conditions. Okay, so that I'll be discussing today. So the topic for today is separation anxiety disorders and other childhood disorders. So what do you understand by separation anxiety disorder? So as the name itself says, the child will experience anxiety whenever there is a separation. Now, separation from what? It can be separation from the parental figure or separation from any caregiver whom the child is very much attached to. So that is the condition which is termed as the separation anxiety disorder. Separation anxiety disorder is the condition which is characterized by significant distress when a person is away from his parents, another caregiver, or even for that matter, her home, right? So that is termed as the separation anxiety disorder. So let us see the definition of separation anxiety disorder. Separation anxiety disorder can be defined as the primary expression of excessive anxiety that occur upon anticipated or actual separation of the child from the adult caregivers, or you can say especially the parents. So the child can have the severe symptom of anxiety which can be anticipated or which can happen suddenly, wherein the child will experience this level of anxiety when he is separated from the parental figure. So this kind of a condition is definitely going to affect the significant functioning of the child in terms of daily functioning. Not only the child, even it's going to affect the parents as well. Now, moving on to the onset of the separation anxiety disorder. So when exactly will the child develop this condition? Separation anxiety disorder usually is seen before the child, completes his first birthday, and also again it can pop up before the child is 4 years old. So it can vary, upon children to children. Obviously, any child will have a bit of worry or anxiety when he is away from his mom or dad or from his parents. But this normal behavior will fade off as the child will, grow older. But there are still children who will experience this condition even after the particular age group. Maybe even after 4 years or maybe 7 years, 8 years. So they will experience this kind of the symptom. It is noted that the separation anxiety disorder, which is termed as SAD, SAD, is usually earliest form of the anxiety disorder which occurs in the individual. So usually this kind of a SAD condition is noted as early as 8 and 14 months of age. So that earliest age group can experience the anxiety disorder even. Okay, so that is about the onset of this separation anxiety disorder. Moving on to the etiology. So what is the reason that the child will experience this condition? We cannot say there is a one single reason. We have got the various factors, the combination of biological, cognitive, genetic, environmental, child's temperament, as well as the behavioral factors. So let us see the etiology in detail. If you take up the environmental factors, there are certain situations or the environment where the child is being reared is not a comfortable environment for a child, wherein the child may develop the separation anxiety disorder. So in that, the foremost important thing is the parental behavior. So we have got the various parental behavior wherein the parents may show a very low warmth towards the child or low affection towards the child, discouraging autonomy in the children, okay, being very much overprotective. Certain factors like attachment relationship with the parents or the caregivers wherein the attachment is so much that the child will feel very much insecure when the parental figure is not there, or the child may have an anxious attachment styles. Without the parents, the child will feel very much anxious. So such kind of attachment relationship that the child and parents would have developed. The next one is the locus of control. So locus of control is nothing but the child's thought as well as ability to control the environment, right? So if the child is lacking this particular skill of controlling his environment or getting adjusted to the environment, the thought of the child which is very much anxious, so the locus of control, if the child is not developing, then child may end up with the separation anxiety disorder. If you take the genetic factors, it is seen that the mothers of these children who are suffering with the separation anxiety disorders are themselves had an history of the anxiety disorder. So you can see that there is a higher risk for the children to develop the separation anxiety disorders if the mothers even had the condition of anxiety disorder. The next factor is the temperament of the child. So there is a very close connection between the temperament of the child as well as the development of the separation anxiety disorder. So there are children who are having this temperament of being very shy and timid, which is usually termed as behaviorally inhibited temperaments. The child will become very much anxious when they are not familiar with the particular situation, environment, or even for that matter the person. If they are not familiar with, say for example, they are meeting a stranger. So even meeting a stranger, being in such an environment itself, the child will start feeling this anxious kind of the behavior. So such a kind of a temperament of a child who is very much timid and shy may develop the anxiety disorder. So that is about the etiology of the separation anxiety disorder. So let us see what is the prevalence of the separation anxiety disorder. It is noted that about 5 to 25% of children worldwide suffer with this kind of a separation anxiety disorder. It is also noted that 50% of the anxiety disorders are contributed by this condition, which is the separation anxiety disorder. So this is the prevalence of the separation anxiety disorder. Moving on to the symptoms. So what are the clinical manifestations of separation anxiety disorder? The child will experience an unrealistic and lasting worry that something bad would happen to the parent if the child leaves the parent. So that kind of a fear or excessive worriness or anxiety the child will experience, he feels that something bad would happen to the parent if the child leaves him. Right, that's the first symptom. The second symptom is again the child will experience an unrealistic and lasting worry that something bad would happen to himself or to the child if the parental figure or the caregiver leaves the child. So vice versa, both the conditions, the child will experience this unrealistic and lasting worry or anxious feeling. So in order to stay with the parents, at times the child may refuse to go to the school because of the fear of the separation. The child may have difficulty to, even sleep, right? He may refuse to go to bed because of the fear that the parent or the, caregiver may just move away from him. So even the child will experience the difficulty to sleep. Other symptoms such as fear of being alone. You may experience nightmares of being alone as well as being separated. You may have bedwetting behavior. You may have this complaints of the physical symptoms. Okay, so he may convert this psychic conflict to the physical symptom wherein he simply complains that he'll have bodily symptoms like headache or stomach pain, okay, during the school days. So just because to escape from the school to, see to it that he doesn't get separated from his caregiver, he will complain about the physical symptoms. He will have the repeated temper tantrums as well as the pleading behavior, always pleads the parents not to leave him. Okay, and also a lot of temper tantrums the child will experience. He will cling on to the parent whenever he figures out the parent is leaving him. So these are the signs and symptoms that you can notice in the condition of separation anxiety disorder. Moving on to the treatment. So, what is the treatment for this condition? We don't actually use the medical management, in a sense, we don't use the psychopharmacological agents unless and until it's very much indicated. If the anxiety is severe and it cannot be controlled, only then the medication therapy that can be given, usually anti-anxiety medications can be administered. Apart from this, mainly we have got the use of the psychotherapies. Number one, we use the CBT, cognitive behavior therapy, to bring about the changes in the cognition as well as the behavior of the child. The child may have to undergo some behavioral modification techniques or the therapies such as modeling, systematic desensitization for the behavioral modification. So apart from that, to reduce the anxiety, we can use various relaxation therapies, imageries, as well as try to distract the child from the anxious condition. So this is the treatment modality that we can have for the separation anxiety disorder. So that is the first condition which I have discussed, which is the SAT. Moving on to the second condition which can be noted in the children, which is the sibling rivalry disorder. So what is sibling rivalry disorder? So as the name says, the child will experience a rivalry. As the name says, the child will exhibit certain kind of a behavior which is very much kind of a rivalry behavior towards the sibling. That condition is called as a sibling rivalry disorder. It is usually seen in the elderly, children, especially majority of these children will develop a degree of emotional disturbance following the birth of the younger sibling. So say for example, okay, a parent gives birth second time to a baby. The first or the eldest sibling will experience some kind of a emotional disturbance, a kind of jealousy that we can say towards the younger one, because the child may just feel that the affection, the love what the parent used to give him is being given to the new one. Okay, so such kind of a fear or emotional disturbance the child will experience, because of which he will develop the jealousy or he will develop the rivalry behavior towards the younger sibling. So usually the children show the extreme form of jealousy, okay, or the other rivalry kind of the behavior, which is usually started after the months of the younger child who is born, right? So jealousy to go to such an extent that in the presence of the parents, the eldest sibling will show a lot of affection towards the child. Once the parent moves out, for some or the other reason, he may show a lot of anger towards the younger sibling, wherein he may physically harm the child, or he may pick up some fights with a sibling, or such a kind of behavior that is very much rude can be noted in this kind of the disorder. So that is the sibling rivalry disorder. The next condition is the generalized anxiety disorder. So what is this generalized anxiety disorders? Even you can note it in the adults as well as in the children as well. So in the children, they also develop this anxiety disorder. So various kinds of the anxiety disorders you can note even in the children. Let us see all of these. The first one here is the generalized anxiety disorder. So as the name says, generalized anxiety. The child will worry about each and everything which comes across him. So he or she will excessively worry about a variety of things such as grades, family issues, relationship with the peers, and even performance in sports. So generally he will be very much anxious related to all the situation. Such kind of children who are having the generalized anxiety disorder will be hard on themselves, and always they will be striving for the perfection, because they will always seek for a constant approval and reassurance from others. They always wanted to be identified by the other people, because of which they will strive very much hard to do any of the thing in a perfect way. So because the child is on a run to do in a perfect way, generally he will experience stress as well as the anxiety. So that is the generalized anxiety disorder. The next one is the obsessive compulsive disorder, which we can see even in the children. OCD is characterized by unwanted and intrusive thoughts, which is termed as the obsessions. Okay, unwanted repeated thoughts which keeps coming in the mind of the child, that is termed as the obsession. Because of these obsessed kind of thoughts, right, he will be compelled to perform it in a particular way in the form of the action, which is called as the compulsion. Just to cease his anxiety, he will be forced to do a particular action. Okay, once the particular action has been fulfilled, his anxiety will just be released, right? So such a condition that you can note even in the children, which is termed as OCD, obsessive compulsive disorder, which arises because of the anxiety. Most of the children who develop this OCD are usually falling between the age group of 10 years, but it can even strike as early as 2 to 3 years. Boys are more likely to develop this OCD condition before they attain their puberty. During the time the girl attains her puberty, or even after that, during the adolescent period, the girls will develop this kind of the OCD condition. Moving on to the next condition, which is the panic disorder. So when can the child be diagnosed as having the panic disorder? So panic disorder can be diagnosed if the child will experience at least 2 unexpected panic or anxiety attacks, which means that without any reason, suddenly the child will experience a kind of a panic attack or an anxiety attack. So if the child is witnessing so if a child is experiencing this kind of a panic attack or the anxiety attack at least twice in his lifetime, then you can diagnose him as having the condition of panic attack. Another thing that you have to keep in mind when you are going to diagnose this panic attack is the child should have at least a gap of 1 month from one attack to another attack. Okay, if the child is having experiencing a panic attack, say in a month, okay, then after 6 months he experiences another panic attack, you cannot diagnose him as having a panic attack. But if he is having a difference of 1 month, within 1 month of first panic attack that he is having another one, then you can diagnose him as having panic attack, or you can simply say that he is going crazy. The next condition is the phobic anxiety disorder. So what is this phobic anxiety disorder? Yes, each and every children during a particular age group, it is normal that they will have this fear towards darkness, or towards dogs, or towards insects, towards animals, right? That is very much common. But if the child is experiencing this kind of a fear after crossing a particular age, right, which is going to disturb him, on his daily functioning, then it is going to be a problem. So the child can experience the phobic anxiety during various situations. It can be towards animals, insects, darkness, even for that matter, the school or death. So all these are few conditions for which the child may develop the phobic anxiety disorder. The next condition is the post-traumatic stress disorder. So what do you understand by post-traumatic stress disorder? So after the child has witnessed a traumatic event, he will develop the stress. So that is termed as the post-traumatic stress disorder. So the child may have an intense fear and anxiety, wherein he can become emotionally numb or very much easily irritable, and avoid even the people, places or activities after experiencing or witnessing a traumatic or life-threatening condition. Say for example, during the childhood period or during say toddlerhood period, the child had experienced a traumatic event in his life. Maybe it can be a death of a parent, or it can be a disaster which the child has witnessed in his life. Can be a natural disaster or a man-made disaster. Such a kind of a disaster or events which the child had experienced in his life can develop the post-traumatic stress disorder in his lifetime. So it is normal for any child to, experience this kind of a fear or anxiety whenever they experience the traumatic event in their life. But many children will be able to recover from it after a short period of time. But very few children will take it for their life time wherein they end up with this condition of post-traumatic stress disorder. So what are the risk factors of developing the post-traumatic stress disorder? Number one is the children who directly witness any kind of a traumatic event. So such a child is at risk of developing this PTSD. Children who suffered indirectly, for example, any kind of an injury or death of a parent or a loved figure, that is an indirect way wherein the child would have experienced the traumatic event, so because of which he is at risk of developing the PTSD. Another risk factor is the children who are having this. Another risk factor is the children who had mental health issues before they even witnessed the particular traumatic event. Such children will develop the PTSD. Next is the children who lack the support system, right? If they're not having a good support from the family, or they lack the support system, in those conditions, the child may end up with the PTSD. The next risk factor is even the violence at home can predispose a child to develop the PTSD. It's very much important that the parents are educated related to the conditions of the children that they may develop, because the family is the foremost important support system the child is having. If there is a lot of conflict or violence in the family which is happening, it can definitely have an effect on the mind of the child. Okay, so these are the various risk factors wherein the child may be at risk of developing the post-traumatic stress disorder. The next condition is the social anxiety disorder. So what do you understand by the social anxiety disorder? Okay, the child will experience the anxiety in the social situation. So whenever he is there in a group, right, whenever he faces a particular group, right, or the society, he will have this kind of the anxiety. That condition is a social anxiety disorder. So this is also very much common. Otherwise, it is called as the social phobia. This condition is characterized by the intense fear of social and performance situations, as well as the activities such as being called in a class for a presentation, or to talk about a topic in front of a group, or even for that matter, he may even have a phobia towards interacting or starting the communication with his peer, right? So such a condition is termed as the social anxiety disorder, or as social phobia. So when the child is having this kind of a condition, it's going to significantly affect his functioning in terms of performance in the schools or in terms of attendance. So he may just have a fear to face the school or to go to his class because of his fear, right? He may stop going to school, or he may have a poor performance in the school, or attendance may be very poor because he will miss the school or the classes. Even for that matter, his ability to socialize and develop that relationship with others or his peer group will be impaired. So that condition is called as a social anxiety disorder. The next condition is the selective mutism. So what do you understand by selective mutism? Mutism is being mum, okay, or being very quiet, not responding, right? That is called as mutism. Selective mutism, in a sense, only in certain selected conditions the child will become mute. Okay, only in few settings or few situations the child will exhibit this behavior of being mute, whereas in other situation, wherever the child feels very much comfortable, he is normal, right? That is called as the selective mutism. So children will refuse to speak in situation where actually he requires to talk, maybe with his peers in the school or with his friends. So such a kind of a situation wherein he stops talking in such situation can arise or can be termed as selective mutism. Whereas if you take the other part of the child, they will be very much talkative and they may display a normal behavior when they are at home or when they are with a company where he or she feels very much secure or comfortable. During those situations, he may be very much normal, he will talk a lot. So parents may be surprised very much when they hear it from their school teacher that see your child is not talking in the school, whereas the child parents feel that at home is very much normal. Why is he? I mean, it may not be that way. That's what they may be very much surprised that they may when they get the report from the teachers that there is a behavioral problem in the child in terms of being very much mute. So, what are the signs of selective mutism? The child may stand motionless or expressionless. So, maybe in the school when something is being told or something is being asked by the teacher, the child may just stand very much still. Maybe he is in a state of stupor, not responding to the teacher, or he may not show any kind of an expression when someone is talking to him. Right. So, that kind of a sign that you can note. So whenever anything is being asked, he may just turn his head, which notes that he is not interested, or he may try to avoid those situations. Okay, so he may just turn his head. He may just have this peculiar behavior of chewing or twirling his hair whenever he is speaking. So this kind of a condition also shows the anxiety of the child. He may have he may avoid the eye contact. Sometimes he may stay alone or withdraw into being very isolated, or he may just sit in a corner to avoid talking. Okay, so such kind of a signs that you can note the child is suffering from the selective mutism. So what is the age group that the child will suffer from selective mutism? So usually the diagnosis is between the age group of 4 and 8 years. So that is a child who goes to school just when he has entered the school, right? Between 4 and 8 years, this kind of a behavior which is abnormal can be noted. Moving on to the next condition, which is the specific phobia. So what is this condition? Here the child is having a fear, irrational, intense fear that the child will experience towards specific, object, towards a specific situation, or towards a specific person. Okay, so that is called as specific phobia. So a specific phobia is an intense, irrational fear towards a specific object, such as a dog, or towards a specific situation, such as flying. So under this, the common specific phobias that you can note is water, blood, darkness, and certain medical condition. Maybe for even an injection, the child may be having a fear. So what are the signs that you can notice in this condition, right? The child may just avoid the particular situation which is very much feared of, which can be manifested in the form of crying, temper tantrums, clinging on to the caregiver or the parent, avoiding the situation. He may have the physical complaints like stomachache or headache just to avoid those situations. Okay, so that is about the specific phobia. Now, what is the treatment? Okay, we have got a non-pharmacological treatment modality. So, in the children, okay, so before we even start the pharmacological treatment, we use a non-pharmacological modality of the treatment because it is not preferable for a child to start with the psychiatric medications, right? So, usually we start up with the psychotherapies, the counseling sessions for the child as well as the family and parents. Few therapies that we use, the play therapy. So play therapy is a therapy which will enable the child to express his emotions, to express his fear or condition or thoughts, right? Because the child is very much reluctant to expressing his feelings or emotions through words. So through the form of play, the child will be able to express his emotions or difficulties, wherein the therapist will be able to diagnose and plan the treatment accordingly. We may have the next therapy like the behavior therapy to bring about a modification in the behavior, right? So we may have the exposure therapy, exposing the child to a phobic stimulus or use of systematic desensitization, emotive imagery techniques that you can use, modeling, as well as the contingency management. Say for example, if the child is having a fear to go to school, right? So child may be forced to go to school to such an extent that his symptoms will be reduced, right? So he is having a separation anxiety disorder, because of which the child is very much fear that he may get separated from his parental figure. He may avoid going to school. So in those conditions, you can force the child to just push the child to go to school, so that he will confront the situation, he will be able to fight the situation rather than flying away. So eventually, we can note that the symptoms will start decreasing. Now, what do you understand by the contingency management? Contingency management is one of the treatment which is very much effective that you can note in especially the children with the separation anxiety disorder, wherein the management just revolves on the system of reward. It can be a verbal reward or a verbal reinforcement that you give, or you can even have a tangible reinforcement, because of which whenever the child does well, when you give a reward, he feels that a particular behavior is accepted and he feels to be motivated to practice the same one. So it is noted that the child who undergoes a contingency management have shown the signs of independence whenever they are being praised verbally or given any kind of a reward. So the best method that we can use for the separation anxiety disorder is the contingency management, which involves a reward system. The next therapy is the family therapy. So since the child is a very important person in the family, the influence of the family can have an impact on the child, right? So obviously the family therapy is indicated wherein the parents are educated, the parents are counseled, and also helping out the parents to develop the adequate parental skills, and also to recognize the child if the child is having a behavioral problem. So that is what is done in the family therapy. The next therapy is a cognitive behavior therapy. So even in the cognitive behavior therapy, the thoughts have to be modified, the behavior of the child to be modified. So you're going to have a combination of cognitive therapy and the behavior therapy, wherein the modifications in the behavior can be brought about. So these are the non-pharmacological methods of treatment that we have for the childhood conditions. Moving on to the pharmacological methods. So we use the pharmacological treatment, especially when the condition of the child is very much severe. Okay, severe separation anxiety disorder, the child is experiencing to such an extent the child may refuse to go to school, and all non-pharmacological method fails in the child, then we opt for the pharmacological therapy. So we will be using a group of drugs, that is selective serotonin reuptake inhibitors, for the condition of SAD. So this is about the management of a child with the other childhood disorders. So you have seen various conditions such as separation anxiety disorders, the anxiety disorders, then you have got various phobic conditions, selective mutism, sibling rivalry disorders. So all these are few conditions which you can definitely note in the children, right? Hope you all have understood the topic. Thank you.